Hello, good morning, good afternoon, good evening, wherever you are in the world. This is Amaka again. I just thought I'll pop in here, say hello to you guys, check in how you doing your finances. Did you manage to have a look at your expenses? Have you had a chat with your partners? Have you looked at what your budgeting would require for this month? For me, I'm not doing very well with budgeting, but I have looked at my expenses. I have looked at the places where I'm vulnerable. I've looked into the psychology of money. There's actually a book called The Psychology of Money. You should look at that. You should look at that book. And I'm taking a course on financial management, which was kindly gifted by my sister. And this, I think, is going to help me plan for the next 10 years. And I say 10 years because your behaviors kind of pile up, isn't it, to create the lifestyle that you're living. And my behavior in the last 10 years changed quite significantly and has resulted in my reality at the moment, which I am absolutely in love with. And it's almost like proof that when you do things right, you get the right results. So for this month, or for this video really, my goal is to talk about supporting people with mental health problems. Throughout this month, I'll do a few videos on that topic from different angles, and I just thought that to leave it open to discussion. What would you like to know about supporting people with mental health problems? I've had the privilege of being on the professional side of things. I've had also the privilege of being on the support system side of things and having to support friends and family. So mental illness, as you know, can come in a variety of presentations. People, it's part of life. One in every four of us will have a mental illness, and in some illnesses even much more, especially where you have a family history or where you have environmental conditions that predispose you to that mental illness. And that's why I decided to kind of start this channel, so that we are more aware of the things that make us vulnerable to mental illness. We know how to prevent them, we know how to ride the tide, we know how to find joy even when things are not perfect, because that's life, isn't it? So many of us throughout our lifetime will have one mental illness or the other. Not everybody's mental illness will get to the hospital. Not every mental illness will be even noticeable by others, because we have people who we call high functioning mentally ill people. So they live their normal lives. It's just that they develop some coping mechanisms to help them live their normal lives. Some of it may be alcoholism, some of it may be being very meticulous and perfectionist. Those kind of coping mechanisms help people to cope with their illnesses. Some people are not even aware that they're unwell. They're just seen as people who are difficult or people who have coins going. Yeah, so my goal is to just put more light, educate more people on how to support. So if you do find that there's somebody around you who has been struggling, obviously, because the people that are not obvious will probably take a professional to make a diagnosis, but someone who is actually struggling, more commonly you will see this in a woman who has just had a baby. She used to be very well put together, and now she's not showering, she's not getting out of bed, she's sad, crying all the time, sometimes even having some scary thoughts towards herself or her baby or people around her. Sometimes you see, more commonly again, people who are in a domestic abuse situation or being abused in other ways. Behaviors that come up that are not usual for them. They're acting out of character. They're not themselves, and that's not in a good way, because sometimes people change behavior in a good way. They're acting not like themselves. The things that they're doing are not in keeping with their social circumstances, their educational circumstances, not in keeping with their religion or their family, kind of totally out of character. Those are the people I'm talking about. You see somebody like that, what do? Where I grew up, those kind of people were usually pushed to conform to what everybody around them was doing. pushed to get in line, or then isolated, so that they eventually maybe wandered away from family, or were just kind of neglected and just lost themselves totally. And when it got really bad and they started to disturb the peace, public peace, they would then be taken to a psychiatric hospital, by which time sometimes it can be too late because the person has been unwell for a very long time. It's hard to kind of trace the way back. So the earlier you seek for help, the better. You're not a professional. It is not the time to blame them, or to set really high standards for them, or to beat them up. It is time to take them to the hospital, get them seen by a medical professional, get them seen preferably by a psychiatrist. But if you do not have such specialties in your area, a medical professional, a doctor, a trained doctor, a qualified nurse, a qualified psychologist will do, because then these people know the limits of their practice, and then they can refer onwards if it is needed. Ask for help. Yeah, that's the first thing I'll say. Ask for help. The next thing is to talk to the person, see how you can support them. They need help doing laundry. When somebody is unwell, it's not the time for you to tell them that they are smelly. Take their laundry, do their laundry. Practical things, make food available for them, make sure that they are safe, that where they are living is safe, it is warm, they have good clothes to wear, they have food that they can eat without having to cook it. Make sure that where they live is clean. If you neglect them because they're smelly, that's not going to make the smelly go away. Doesn't make sense. You go in there, you clean up, you come out. You pay somebody to do it if you can't do it. If you have the means to do it, or you make kind of like a support system rota or rotation, so that it's not all the burden doesn't fall on one person. Everybody that loves them can pitch in and do one or two things every week. It's just the practical things, keeping this person safe, letting them know that they are loved. They may not be in a position to thank you. They may not be in a position to show gratitude. They may not be in a position to even recognize that you're helping them. But do the kind things to do, even when it is not it's not convenient for you at the time. So you sit with the person. If the person is able to talk, ask them how you can help. Ask them if they want to be alone. Ask them if they need company. Some people just need somebody to sit down there so that they are not alone and they're not terrified. Because some of the thoughts that people that are unwell have are very, very scary. And having somebody who loves them just in the vicinity is enough to keep them safe. It's good to have emergency numbers you can call. That can be your local hospital. That can be a charity number. That can be a telephone helpline. That can be an ambulance. That can be your crisis team. It's always good to have numbers that you can call. I always advise paste them on the fridge or somewhere that everybody can see when they come into the house. I'm assuming that, somewhere where somebody's mentally ill, it's not somewhere that strangers will be walking in and out of. So family members, people who love them, partners, know who to call if there's an issue. If they have any medication that they used to take and they have stopped, encourage them to start taking the medication again. This is not a call to force them, because forcing someone to take medication can be very dangerous. If they refuse to take their medication, ask for help. Ask a professional for help on how to do it. Yeah? Nobody should force anybody to take anything you don't want to take. You can plead with them. You can reason with them. You can even bargain with them based on your relationship. And, sometimes people know that they're unwell. Unfortunately, they're not just able to continue taking medication for a long time. They stop taking the medication and they become unwell again. So that is my encouragement for you today. Supporting people can look in so many different ways. And throughout this month, I will talk about it. But I think that for now, these three things are the important thing. Ask for help. Help them with practical things. Make sure they're taking their medication. Make sure they have people to sit with. Make sure they are safe. 5 things, not 3. Have a lovely, lovely, lovely afternoon. Do take care of yourself and help each other. Bye.